Welcome to Healthcare Reform Demystified. Today's episode, The Highlight Show, Summary of Benefits and Coverage. Oh, wow. Oh my gosh. Oh, well, who knew? Oh, sorry. In those dark days before the internet, information wasn't always easy to come by. Back when Google wasn't yet a verb, if you needed to learn something, you had to hit the books. Literally. Let's say you were assigned to read Moby Dick for Miss Grundhofer's American Literature class. Late one night, you realized that you had an exam on the book in less than 2 days and you hadn't even cracked the cover. You had two choices: pull an all-nighter and start plowing your way through 800-some pages, or pick up one of these slim little grade savers. Cliff Notes summed up the main points of just about every book in the library in a few dozen pages. This came in handy if the book in question was especially lengthy or complex. If you've ever read a health insurance policy cover to cover, lengthy and complex are just two of the words that come to mind. That's why the healthcare law calls for insurers and group health plans to provide a summary of benefits and coverage, SBC for short, for each coverage option they offer. The SBC gives you the highlights that you need to know about benefits, coverage, and costs in language that you don't need a dictionary to sort out. It's basically Cliff Notes for health insurance. Let's take a closer look at what you can expect to find in each plan's SBC. In keeping with the spirit of the summary of benefits and coverage, I'll just hit the highlights. The SBC will summarize the key features of the plan, namely covered benefits, cost-sharing requirements, coverage limitations and exceptions. The SBC will also offer examples of coverage provided for certain common scenarios to help you understand and compare your share of the costs of care you might receive for these conditions: having a baby and managing diabetes. These will be the initial scenarios, but other scenarios may be added in the future. So far, so good, right? But it actually gets better. To make sure the SBC keeps things simple and useful, there's also a standard format for the SBC. For example, the SBC must be no more than 4 double-sided pages. It must use at least a 12-point font. It must include a description of coverage for each category of benefits listed on the form, including cost sharing, and it must specifically identify certain exceptions, reductions, and limitations on coverage, as well as cost-sharing provisions, renewability, and continuation of coverage provisions. One more thing. Under the healthcare law, consumers and employers will actually have 2 documents that make it easier to understand their health insurance options: the summary of benefits and coverage, and a uniform glossary of terms commonly used in health insurance. This glossary will help you understand some of the industry jargon that tends to crop up even in an SBC. You shouldn't need a degree from medical school, or law school for that matter, to know what your health care coverage options are. And while the new summary of benefits and coverage and the uniform glossary won't replace the full policy documents, you can probably spend less time reading them. And speaking of reading, if I'm going to knock off the complete works of Shakespeare before supper, I'd better get busy.
This above all, to thine own self be true.
You can find more answers to questions about the Affordable Care Act on the United for Reform website. And as always, contact your broker or a United Healthcare representative with any questions about your plan. Ooh. Oh my gosh. What in the... You're kidding me. I didn't see that coming.